Welcome to CMS You. I'm your host, Dominique Matherin. Each month, we bring you up-to-date information from the Centers for Medicare and Medicaid Services, or CMS. CMS is the federal agency that administers Medicare and oversees Medicaid and the Children's Health Insurance Program, as well as numerous other national health-related programs. On today's show, we're talking about the harmful effects of tobacco. Using tobacco products damages the health of smokers and those around them. It harms nearly every organ of the body and can cause deadly diseases like cancer, heart disease, stroke, and chronic obstructive pulmonary disease, or COPD. We're fortunate to have Deepa Prasad. Deepa is a program manager for NYC Treats Tobacco at New York University Langone Health Department of Population Health. She has 12 years of experience in the healthcare center, including 8 years specifically focused on tobacco control. Welcome as well to Deidre Sully. Deidre is the director of NYC Smoke-Free at Public Health Solutions. She has over 10 years of experience in the public health field. We also are welcoming back to CMS You, Maha Attieh. Maha is the health program manager at Arab American Family Support Center. She's also a health insurance navigator with the New York State of Health. Thank you all for being here today.
Thank you for inviting us.
Thank you for having us.
Yeah. Wonderful. So let's start by learning a little bit more about each of your organizations. So why don't we start with you, Deidre? Why don't you tell us what your organization does?
So, sure. So I am the director of NYC Smoke-Free. As you said, we're a program of public health solutions. And NYC Smoke-Free has been around for a little over 20 years, doing a lot of tobacco control, education, and advocacy within New York City. Currently, our program focuses on a two-pronged approach using community engagement and youth engagement. Our youth engagement arm is part of a larger state-wide program known as Reality Check, where we work with young people to make them into young advocates using tobacco control as the content area. And it's really what we do both on the youth engagement arm and the community engagement arm is about increasing awareness about tobacco control and the harmful effects of tobacco, raising awareness about changing social norms and policy.
Awesome. And Ma, why don't you tell us?
Thank you for inviting us.
Sure.
As I said, my organization is a community-based organization. We located downtown Brooklyn, and we have a pilot office in Queens. We are an agency for social services. We have preventive services ACS program, my program, which I enroll people through the marketplace, New York State of Health with the health insurance. And by the way, this is the open enrollment for New York State of Health. We start in November 1st to January 31st for people to get insured for 2018. And we have ESL program, we have youth program, after school program, domestic violence program, and we have staff stations at the Five Boroughs Family Justice Center.
Very well. And Deepa?
Thank you for having me.
Sure.
So my program is called NYC Treats Tobacco. We're funded by a grant from the New York State Department of Health Bureau of Tobacco Control, but we're based at NYU Langone Health here in New York City. Our goal is to work with healthcare organizations throughout the 5 boroughs of New York City and work on systems improvement to support the delivery of tobacco cessation services. So what that means is we help these healthcare organizations do a better job of helping their patients quit smoking by building in systems that help prompt them to ask about tobacco use, and when they identify a tobacco user, they can offer evidence-based cessation treatment to those patients.
Okay. Well, now that we've learned a little bit about what you do, before we get too far in the show, why don't we talk a little bit more about the harmful effects of smoking? What would you like our viewers to know? So I'll just, go with each of you, starting with you.
Sure. So, tobacco harms nearly every organ in the body. There isn't really any health condition that you can think of that probably isn't affected negatively by tobacco use. Not only that, it harms people around the smoker through secondhand smoke and actually third-hand smoke.
So third-hand smoke, people may not know about it very much. There's emerging research on it, is the residue from tobacco smoke that settles on surfaces. And children and pets are actually very vulnerable as they play on the floor and touch various surfaces and may put their fingers in their mouth and so forth. But tobacco is responsible for more than 480,000 deaths per year in the United States of America.
Anything you two would like to add to that?
And just to add on to that, in New York State alone, it's responsible for over 28,000, and in New York City, over 12,000 people. So people in New York City, over 12,000 residents die every year from tobacco. And I believe from secondhand smoke, that number is over 3,000. So it is very, very harmful. Secondhand smoke can never be isolated, so which is why we work on one of our initiative areas in smoke-free housing. There's no harmless level of exposure. It's all harmful.
So, smoking to me is very harmful for the human body. It's very harmful, it's very expensive, it's costly, and people, they don't know smoking, it's not just from cigarette, and there is hookah smoking. It's affecting our population. Every immigrant population, they smoke hookah, they smoke cigarettes. They don't know it's very bad for their health, for their brain, and for their pocket, and the people around them, especially children as secondhand smokers.
Okay, so Deidre, you are working with NYC Smoke-Free. How has your work evolved over the years?
Sure. So we generally work on a number of initiative areas, ranging from reducing youth exposure to tobacco marketing. In New York City, we've actually had to shift that to looking at it more broadly and also from a health equity framework. More so looking at tobacco proliferation or tobacco density, if you will. And that's really focusing on how many tobacco retail outlets we have in vulnerable neighborhoods where smoking rates tend to be much higher. So while smoking rates, yes, in New York City have gone down to 14%, which is awesome, there are a lot of pockets of populations and individuals who have not necessarily benefited from that. So disparities still exist. So we've kind of had to shift our messaging to reach those populations where they're more vulnerable, young people, seniors, and people who are in low SES areas. Another area that we've worked on and continue to work on is smoke-free housing. Again, shifting that from just the health message to a health equity framework, looking at that everyone deserves the right to breathe clean, smoke-free air in their homes, especially, not just folks who are fortunate enough to have, luxury condos or market rates, but also people who live in affordable housing or public housing. So we work with those individuals to raise awareness about the benefits of living smoke-free.
So what's on the horizon for NYC Smoke-Free?
So I think for us, we are continuing with that health equity framework, looking at things like menthol and their effects on certain populations. African Americans, women, and children smoke menthol cigarettes at higher rates. The smoking rate in New York City is 14%, and out of smokers, over 85% of African American smokers smoke menthol cigarettes. So that's something that we're actually looking at into broadening our area of tobacco disparities and trying to close that gap.
It's quite interesting. So I'll just switch over to you, Deepa. Your program helps people quit.
That's right.
So what are the goals? What are some of the goals? Why don't you talk to us about the goals of your program and how you're helping people to quit?
Sure. So we help healthcare organizations better serve their patients by improving how they deliver tobacco cessation services so that when a smoker is motivated to quit, they can seek healthcare services and get evidence-based treatment for their tobacco use. And also following up on what Deidre said about certain populations that smoke at higher rates, we find that people with behavioral health conditions, which means a mental illness or a substance use disorder, smoke at even higher rates than the general population. Some groups above 50%, which is far above the overall smoking rate. So we focus a lot on medical health organizations, but also behavioral health organizations to help this underserved population.
Very good. Thank you. So, Maha, you have been working on the health issues related to hookah smoking.
Yes.
So, some of our viewers may not be familiar with hookah smoking. So, can you tell us a bit more
Yes.
about what hookah smoking is?
For the past year, we've been trying. I work very closely with the council member Gentili, and the rest of the council. 27 of the council members, they approved it, that they wanted to add the bill to clean air bill for the New York City. Hookah, it's a culture thing. It's a pipe, water pipe. On top of it, they put tobacco. People, they don't know that this tobacco is very dangerous for the health because they put charcoal on top of it in order for them to inhale it and smoke it. They think if it's through the water pipe, it's safer for them, which is not. I would like everyone to know that 1 hour on the hookah, it equals 100 cigarettes or more.
Wow.
Yes. So it's very dangerous because it has the carbon monoxide, the material that they inhale to their body, it results in cancer. So we would love, because there is lack of information and health material on hookah smoking, the law, they're going to remove the permit if they didn't have ventilation in the hookah bars, especially if they have, half of it is a restaurant, there is children sitting there. The people who work in these hookah bars, they are second-hand smokers too. So we need to bring awareness and educate the people who are smoking hookah, how dangerous it is for their health and for their families.
Okay, so you just mentioned hookah bars, which may lead people to believe that it's kind of okay to smoke hookah. So what would you
Which
say
is
to
not
those?
safe,
Yeah.
because before the bill, they were allowing 18 years and older to go inside these hookah bars. They found that they did a study with 13 hookah bars. 13 of them, they have violation in them. The decoration is not fire safe. There is no ventilation. Because there is a fire and charcoals involved. There is no fire extinguisher in these places. So they need to work on it, or otherwise they're going to lose their permit. So it's very important to educate the owners themselves. If they don't want to lose the business, they need to work to fix what violation they have in their establishment. And they have to educate the people that smoking, just they do on the pack of cigarette, that hookah smoking is very dangerous for them too.
So what would you advise all three of you in terms of quitting? What would you advise the public? Actually, before we move on to that, why don't you talk about the smoke-free public housing? Because I know that you guys are doing some type of work with public housing in terms of smoking cessation.
Yes. So NYC Smoke-Free has been working very closely with NYCHA. We have been invited to sit. NYCHA is the New York City Housing Authority, and we've been invited to sit on their advisory committee to work with them as they implement the HUD rule. So earlier this year, in February, HUD, the Department for Housing and Urban Development, passed a rule that all public housing authorities have to go smoke-free. NYCHA, being a public housing authority in New York City, the public housing authority, the largest in the country actually, falls under that. And so we'll be working with them as they implement the HUD rule, which is fantastic because, as I said before, everyone has the right to breathe clean, smoke-free air, not those that just can afford a smoke-free housing as an amenity. So we'll be working closely with them as they get that underway, and it will be July of next year where all public housing authorities will have to be smoke-free.
Oh, interesting to know. So I guess I'll go back to you, and I'm asking this question to each one of you. What advice would you give someone who is trying to quit
Sure.
smoking?
Well, I would say that it takes multiple attempts. Research has actually shown that it takes multiple attempts for most people to quit smoking for good. So I would advise anyone who's trying to quit to not give up, and that each time you make a quit attempt, even if you're unsuccessful in that quit attempt, it's a learning opportunity that makes your next quit attempt more successful. So it may take 5, 10, or more tries for someone to quit smoking, but don't give up. Also, I would say don't try to quit without getting some help. There are a lot of resources available to help people quit smoking. Ask a healthcare provider, call a quit line, get medication. Research has shown that medication can double your chances of quitting successfully, and adding counseling to that medication even further increases your chances of quitting successfully.
I think they could have a support group or a support body to help them quit. And I would like to let them know that Medicaid covers the treatment and help them to stop smoking, especially New York State of Health Medicaid. And I would like to add that the age is raised for the hookah bars up to age 21. Anyone under 21, they can't enter the hookah bars and order hookah. They found out that 45% of the people who smoke the hookah at the age of 18 to 24, and mostly high school and college kids. So our advice for them to stop smoking, it's easy. If, especially I use the children for the parents, if I see them smoking hookah or even cigarettes, if you want to see your children graduating and getting married, you need to quit smoking. And help is just around the corner, and there's lots of resources for it.
That's great advice.
I would say, definitely working with NYC Smoke-Free to spread the word, raising awareness among your neighbors, mobilizing your community members, working with young people to join Reality Check. That's the best way that we can work with you to help you quit.
Very good.
And I think as a providers, we need to take it upon ourselves to educate the community about the issues of smoking. And maybe we could go to the hookah bars and places where they sell tobacco, put flyers for them to educate them how bad it is, the issues, or show them a lung of cancer, a person with a lung with cancer, to show them what will happen to them if they keep smoking. It's all about communication and education to our communities.
Right.
If I may, I'd like to also add for the families and friends of smokers to realize that tobacco use is an addiction, and that it's not the fault of the smoker. It's not simply a choice, that there's a highly addictive nature of nicotine, and that they're really fighting hard against a lot of barriers in terms of quitting smoking, including the number of retail outlets that are all around our city.
Yes.
So I would say to family and friends of people who are looking to quit to be supportive and to be understanding of their attempts.
Right. Also to be aware that they're also at risk.
That's right.
Right?
Yeah.
So I guess we've covered this a little bit, but can you talk a little bit more about the resources that may be available to people who are trying to quit in your organizations briefly?
For me, I always advise my clients, make 311 be your best friend. Any service in the city, they could call 311, they could have services in their own language, they could link them to resources. Okay. And plus New York State of Health and CMS, they have on their websites resources where they can connect to services.
For NYC Smoke-Free, and I'm sure like NYC Treats Tobacco, we guide people to the New York State Quit Line or the website smokefree.org. We also, if people are looking to take their building smoke-free, they can also visit nycsmokefree.org, and we can work with you on working with your building to adopt a voluntary smoke-free housing policy.
And plus, any person would like to quit, the best chance for them to speak to their own doctor.
Absolutely. Yeah. Thank you so much. We've heard some great information today, and we've gotten some great advice, and we've had a chance to learn about each one of your organizations, which I think is amazing, and you're doing great work in the community. So we thank you for being our guests today. For more information about tobacco and health, please visit www.cdc.gov/tobacco. For more information on Medicare services, please call 1-800-MEDICARE. We are available 24 hours a day and 7 days a week, or check out our website at www.medicare.gov. For more information on what Medicaid tobacco cessation services are provided in your area, call your local Medicaid office. You can also get information at www.medicaid.gov. You can get help on how Medicaid covers any types of services where you live. Until next time, be well.
Hola, me llamo Jessica Quesada de los Centros de Servicios de Medicare y Medicaid y estoy aquí para compartir un mensaje muy importante a las víctimas de los huracanes Irma y María, que son beneficiarios de Medicare. La vida de millones de estadounidenses que viven en Puerto Rico y en las Islas Vírgenes de los Estados Unidos se han visto afectados por estos huracanes. Hoy vamos a responder algunas preguntas relacionadas con los beneficiarios de Medicare, incluyendo a los que están afiliados a un plan Medicare Advantage y están buscando cobertura para un periodo especial de afiliación en este otoño. La primera pregunta, y una de las más importantes: ¿las víctimas del huracán Irma y María en Puerto Rico y en las Islas Vírgenes de los Estados Unidos serán elegibles para un periodo especial de afiliación? Sí, nuestra agencia ha concedido un periodo especial de afiliación. Esto significa que las personas beneficiarias de Medicare tienen hasta el 31 de diciembre de este año 2017 para cambiar de plan Medicare Advantage, si ya están afiliados a uno. Para afiliarse a un plan Medicare Advantage o cambiar su plan de medicamentos recetados o quedarse con su Medicare original. En circunstancias usuales, las personas con Medicare y que no tienen cubierta del plan Medicaid tienen desde octubre 15 hasta diciembre 7 para decidir si se cambian de plan Medicare Advantage o se quedan con su plan de Medicare original. Sin embargo, dado la situación de emergencia, CMS ha concedido hasta el 31 de diciembre del 2017 para hacer cambios en su plan de Medicare. Y estas personas que cualifican para este periodo especial tienen que mostrar prueba de que residen en el área afectada por la emergencia. No. Si el representante de un plan Medicare Advantage le pide prueba de que reside en el área afectada, como licencia, recibos de luz, agua, etc., y usted la tiene, puede proveerla, pero si los documentos fueron destruidos, se perdieron o no tiene acceso a ellos, con que usted indique verbalmente que reside en el área afectada es suficiente información para que el representante del plan acepte su solicitud. ¿Cuándo sería efectivo ese cambio de cubierta de Medicare? El cambio de cubierta de Medicare sería efectivo el 1 de enero del 2018. ¿Cómo las personas con Medicare pueden acogerse a este periodo especial que termina el 31 de diciembre del 2017? Pueden contactar directamente al plan Medicare Advantage de su preferencia para una orientación y los planes pueden procesar su solicitud de afiliación. También puede llamar al 1-800-633-4227, 1-800-MEDICARE, 24 horas, 7 días a la semana. Personas que necesitan asistencia auditiva pueden llamar al 1-877-486-2048. ¿Y qué va a pasar con las personas que son beneficiarios de Medicare, que van a la farmacia y que les han cobrado los medicamentos al costo? Si fue a su farmacia preferida y le han cobrado medicamentos al costo, usted puede solicitar reembolso a las farmacias. Tan pronto la farmacia tenga su sistema disponible, deben procesarle el reembolso de acuerdo a los copagos y deducibles que correspondan. Es importante que siempre exija el recibo cuando vaya a buscar sus medicamentos. ¿Qué más ha hecho la agencia de CMS para garantizar el acceso a tratamientos médicos a personas que están afiliados a un plan de Medicare Advantage y dado el paso del huracán María se tuvieron que ir de la isla a los Estados Unidos? Un ejemplo, digamos que usted está afiliado a un plan Medicare Advantage en Puerto Rico y estaba recibiendo cuidados en su hogar para la curación de una úlcera en un pie. Y sus familiares deciden llevárselo a New Jersey luego del paso del huracán María. Usted puede seguir recibiendo cuidado de su úlcera en New Jersey aun cuando el cuidado sea ofrecido por proveedores que no sean contratados por el plan Medicare Advantage. Si usted decide quedarse en New Jersey por más de 6 meses, debe notificarlo a su plan Medicare Advantage en Puerto Rico y decidir cuál plan de Medicare mejor le conviene en el estado de New Jersey. Para más detalles sobre situaciones especiales por el paso del huracán o estados de emergencia o desastres, puede llamar 1-800-MEDICARE 24 horas, 7 días a la semana, o puede acceder a la página web medicare.gov. Gracias.
Hello, I'm Hira Mirza, and welcome to Hira's Medicare Corner. I'm here from the Centers for Medicare and Medicaid Services to give you a quick update on what's going on in the world of Medicare. As the year comes to a close, everyone's thoughts linger towards New Year's resolutions. Your health should be your #1 priority. The new year is a great time to take steps towards getting healthier. Exercising, eating well, and not smoking are a few ways to maintain a healthy lifestyle, but it's also necessary to get the proper preventive care from your doctor. Fortunately, with Medicare, you can get a number of those preventive services for free. Today, I'm going to discuss a few preventive services available to you. The first one is depression screening. All individuals covered by Medicare Part B are eligible for a depression screening every year. The depression screening must be completed in a primary care setting, such as your doctor's office, so you can get follow-up treatment and referrals for other help. You pay nothing for this screening, so don't be afraid to ask your doctor about it. The second is screening for diabetes. Individuals with Medicare Part B who are at risk for diabetes may be eligible for up to 2 diabetes screenings per year. Factors that may make you at risk for diabetes include high blood pressure, obesity, a family history of diabetes, or a history of high blood sugar. For a full list of risk factors, please visit medicare.gov. This screening is also provided to you at no cost for the people who need it. The third screening is for women only. It's breast cancer screening. Women covered by Medicare Part B and 40 years of age or older are eligible for a screening mammogram once every 12 months. Women between the ages of 35 and 39 are covered for 1 baseline screening mammogram. Factors that may increase your risk of getting breast cancer include a family history of breast cancer, having your first baby after 30, or never having a baby. The screening and baseline screening mammograms are both provided to eligible women at no cost. Finally, a fourth preventive service is the smoking and tobacco use cessation counseling, which is counseling to help you stop smoking or using tobacco products. Any individual covered by Medicare Part B who uses tobacco products is eligible for up to 8 face-to-face counseling visits in a 12-month period. These visits must be provided by a qualified doctor or other Medicare-recognized practitioner. You pay nothing for this help. These are just 4 of the many preventive services provided by Medicare. Make sure to talk to your doctor or healthcare provider to find out about many other preventive services provided for free by Medicare and about which preventive services are right for you and how often you need them. For more information, call 1-800-MEDICARE. That's 1-800-633-4227, or visit www.medicare.gov. That's all for today. I hope our reminders always keep you up to date. I'm Hira Mirza, and I'll see you next time.